Respiratory therapists are the people who work with anyone from a premature infant all the way up to geriatric patients, anyone who has problems with their breathing. Now that could be someone who has asthma, someone who's smoked and has developed COPD, chronic obstructive pulmonary disease, or someone with acute or chronic bronchitis. If you have pneumonia, you've probably seen a respiratory therapist. So we work with patients who are coming out of surgery and who need help deep breathing as the anesthesia wears off or through their pain of their incision. So we want to make sure that they continue to breathe well and do well through their hospital course. So the therapists are the ones who give breathing treatments. We work with complicated life support equipment. So whenever someone's talking about being on a ventilator, respiratory therapists are the ones who are running that ventilator. We spend 2 years, a minimum of 2 years training in order to be experts with the lungs. Here in Rolla, we do have a school of respiratory therapy. Rolla Technical offers a 2-year program, and the therapists who graduate from that school have an associate's degree, and we've hired many of those graduates at this hospital. It's a wonderful facility, and the citizens of Rolla are very fortunate to have both the school and the hospital here for their benefit. Respiratory therapists also are involved in diagnostic testing for pulmonary disease. Pulmonary function testing is how we determine what's wrong with somebody, how severe their lung disease is, and whether they respond to treatment. The hospital recently purchased a state-of-the-art pulmonary function equipment set, and we've been testing patients on Tuesdays and Thursdays. And once we've tested the patient, we send the results to their physician for interpretation, and the doctor can decide what is the best way to proceed with their therapy. These pulmonary function tests are pretty stressful. They're a series of breathing maneuvers, deep breathing, holding your breath, blowing out hard and fast, breathing in hard and fast, a real check of the mechanics of your system. And that's when we can tell if you have asthma, if you have emphysema, and once again, if you respond to the different types of medications we can use to treat you with. Pulmonary function testing is a very precise diagnostic tool, and it is underutilized many times. So someone with breathing problems really needs to ask their doctor about pulmonary function testing. When someone comes into the hospital and after they've been treated and are discharged to home, their doctor might decide that they need to go to pulmonary rehabilitation. Pulmonary rehabilitation is modeled after any other rehabilitation program in that we admit patients to our program and we train them and educate them regarding their lung disease. We improve their quality of life by allowing them to be more mobile and to resume the activities of daily living that they haven't been able to enjoy because they've been so short of breath and so sick.